Hi, my name is Christine Hayes, and I am the founder of Hayes Physical Therapy in Paoli, Pennsylvania. And I want to share with you today some exciting developments that we're having with our Class IV Laser therapy as it relates to non-cancerous lung conditions, such as pulmonary fibrosis, COPD, emphysema, and long hauler COVID. And I'd also like to share a story of hope and healing with one of our patients today, and so I want to welcome Nikki joining us today.
Thanks. Happy to be here.
Yes. And so I'm going to reflect back on the very first day that Nikki came into our practice, which was in October, the end of October in 2022. And suffice it to say that I was not prepared for the depth of the evaluation that I was about to do on Nikki. And I was really kind of blown away by the journey that she had been on, and her courage, and also her advocacy for herself, which I was so impressed by. Not only, you're in the medical field yourself, but also you had a team around you that you were able to call on for support. Your pulmonary physician was your referral source to our practice. Also your PCP was very supportive as well. So Nikki came in, and in December of 2020, she contracted COVID-19. And I'll let her share in a moment what that was like, and how horrific that was. And she survived it. And the aftermath of that left her with a lot of different disabling pieces. For one, her lungs, she had some pre-existing very mild emphysema in her lungs. That was certainly worse, but the new finding on the CAT scans was that she had some pretty extensive pulmonary fibrosis in the basis of her lungs. And for anybody that doesn't know what pulmonary fibrosis is, it's a pretty advanced scarring of the lungs. And so it's very difficult for oxygen to get into the lungs that we need for our entire body, and also for carbon dioxide to get out of the lungs as well. So that was pretty significant. She also had severe peripheral neuropathy of her hands and feet, and she also had fall down vertigo. I was worried that you were gonna lose your balance. So she brought her beautiful self into our practice that day. And Nick, just tell us a little bit about, first of all, how did you find our practice?
Well, I was referred to you by a friend who had come to see you for the laser treatment on his knee, and during the course of his treatments you had been chatting, and he got a really good effect from the laser, and so was recommending it to me. So here I came in and had a chat.
Yeah. And so the very first time that Nikki came in, of course, one of the things that I observed was her coloring. And that very first visit, your coloring wasn't that great. It's much better today, but it was more of like a blue, grayish, grayish blue color. Even though it matches your hair, it was not the best color for you. And also you shared that for exertional activities, such as cantering on your horse, which you could only do for maybe a minute at a time, you needed to have 6 liters of oxygen. And also stair climbing was difficult, and so was walking. Anywhere between 4 and 6 liters of oxygen you may need to be on. And then just having regular conversations, at rest, you were, close to 3 to 4 liters of oxygen at rest, having conversation. But the point is, you were never able to be without that oxygen.
True.
And so right after we did our very first laser, which we did directly over the lungs, in the front of the lungs, the side, and the back, and our Class IV laser goes very, very deep into the tissue, your coloring changed right before my eyes. You got to be a more pink color, your oxygen saturation went up. What was that like for you to just experience that after 2 years of living with this life-changing piece?
Well, it's unbelievable. I kept pinching myself because I couldn't believe that I could take a deep breath, that I actually felt like I was getting oxygen as opposed to gasping. It was a good feeling.
Yeah. And, I know on a personal level, I don't think many people can appreciate, what the what the previous 2 years were like, but would you be able to share just a little bit about that?
Sure. It was grim. After 2 weeks in the hospital, I returned home. I was unable to walk from the sofa to the bathroom without desatting to the low 70s. The peripheral neuropathy was really kicking in at that point. So I felt pretty hopeless for a long time. I was housebound for 4 months, could not leave the house. Physical therapy, such as it was limited to trying to be able to stand and sit, basically.
Yeah.
So yeah, it was not a good life that I was having.
Yeah. And on that first visit, I believe you shared too that your pulmonary doctor sort of was out of options and then referred you to the Temple Lung Center.
That's right, yes. So I had a consult with the Temple Lung folks, and his only suggestion was a lung transplant, which I didn't, when I did the research, I didn't think that it was going to give me a greater quality of life. In fact, it would probably restrict me even more, just because of the nature of a lung transplant. And all I want is to be able to ride my horse and go hiking with the dogs.
Yeah, so you lived a very active lifestyle before all of this happened.
Yeah, very much so, yes.
Yeah, and so that took me a minute just to take all that in, and it still does. And when someone says that, their only option really was, 2 new lungs, that speaks to the level, of scar tissue that was in the lungs after COVID. So we embarked on this journey, and we started with our Class IV laser. And the process of laser, for those who don't know, it's called photobiomodulation. And photo means light energy. Bio is your tissue biology, not something in a petri dish. It's not experimental. It's actually been around, for many, many, many years. Since 2004, it was approved, to use on humans. Before that, it was just used in the veterinarian world. But the photobiomodulation goes very deep into the lung tissue, and it stimulates the immune system to start to break down things that are unhealthy, scar tissue, etc. It does not damage healthy tissue, but it goes after the pieces that shouldn't be there. And so once it starts that process of that stimulating effect, it also lays down new protein, which you need to develop collagen, which creates nice smooth muscle in the lungs. So a lot of increased energy for regenerative purposes gets dumped into that tissue. We've had other patients that have used our Class IV laser that have just used that in isolation, have not done the second piece, which you did. And they've also had changes to their CAT scans, which is very amazing. But Nikki, as an advocate, you also combined Class IV laser with hyperbaric oxygen, which is another phenomenal modality. We don't have that in our practice currently anyway. But the combination of the two led you to your first CAT scan, which was literally about 6 weeks after we began.
Yeah.
What were the results? What was that doctor's appointment like for you?
Well, the doctor's appointment was actually in January, and I had read the results, but I didn't do anything with it until I met with my doctor, and he was stunned. He was stunned.
What was he most stunned about?
There was no evidence of pulmonary fibrosis.
Yes, could you say that again?
No evidence of pulmonary fibrosis, and he had to say it several times to me.
Yeah.
Because I couldn't believe my ears. But then he listened to my lungs, and he said they just don't sound like the same lungs that I last listened to. And then the fact that I was only on 1 liter of oxygen, these are all very objective measures. He was surprised in a very good way.
Yeah, well, and it's really unheard of. So these are really amazing results, and we also, there's other centers like Mass General has an entire wing the Wellman Center for Photobiomedicine. And it's really working and studying with patients with a lot of different conditions, including lung conditions. So we're really happy with these results. And again, from being on 6 liters of oxygen for exertion, now you're down to 1 to 2 liters of oxygen for exertion. I don't ride horses, but cantering is really exertional activity. How long can you canter, do you think?
Well, the most I've done so far is about 4 minutes, I would say, and the only reason that we pulled up was because my friend was out of breath.
All right, very good. And then also, you said that around the house, you're not on oxygen at all most of the time, 7 or 8 hours.
7 to 8 hours I can go without oxygen. Now that's if I'm just sitting,
Yes.
like listening to a book or
Yeah.
whatever. But yes, it crept up from being an hour, and then it just kept doubling, and I'm up to 7 to 8 hours now.
Yeah.
Without my leash.
That's right. And to have a leash, I mean, that has got to be awful. Everywhere you go, you're attached to the oxygen, and now that's significantly changed.
Well, it's certainly a permanent reminder, being pulled around by my tubing.
Yeah. My hope for you is that as we continue to do more work with the laser, now the pulmonary fibrosis is healed, the lung tissue continues to benefit from the laser. Our next piece is to really continue to try to improve the emphysema and try to see if we can wipe that down as well, because we do treat folks like yourself that don't need to be on oxygen, that have COPD and emphysema. So that is our biggest goal with you, and I just want to thank you for your determination, your perseverance in finding something that was, maybe outside of the box thinking, and we're happy to be able to be delivering this, for our pulmonary patients in this area. So suffice it to say, I'm also blown away, and I think that this gives not only hope for yourself, but hope for other people.
Absolutely. I think if people can find their way to you, they will experience success.
Yeah, I know. Thank you for helping us get the word out. We
My
really love having you in the practice, and my goal is to get you off that oxygen.
Well, that would certainly be life-changing.
Yeah. Thanks, Nikki.